And the representative of the United Nations International Children Emergency Fund, UNICEF, has said that the world body has measures put in place to combat pneumonia and drastically reduce the death rate caused by the lung disease. Chief of Health, UNICEF Nigeria, Dr. Sanjana Bhardwaj, stated this at an event to mark this year's celebration of World Pneumonia Day in Abuja. Correspondent Rose Audu completes the story.
November 12th every year is World Pneumonia Day, and Nigeria joins the rest of the world to celebrate this day in order to create awareness about the lung disease. According to experts, the lung inflammation is caused by bacteria or viral infection in which the air sac is filled with pus and may become solid. With the theme for this year's edition, Fighting for Breath, Bhardwaj has urged Nigerian parents to ensure they give their children proper treatment anytime they notice the child is having fever and gasping for breath.
We see a lot of different initiatives and interventions that are being done with the leadership of the government, UNICEF support, other partner support. The challenge really is how we take the lessons from these interventions and take them to scale so that we reach more children, more communities, and are able to give the life-saving treatment as well as the diagnosis, making sure children get treatment early so that we do not have any child dying.
Despite being one of the solvable problems in global health, pneumonia still remains deadly as it kills a child every 10 seconds globally. On the average, 1.5 million children die from pneumonia yearly, and these experts opined that a drastic measure will reduce the trend with more awareness on the deadly lung disease.
That just is a message we need to get across to mothers that if they use exclusive breastfeeding, they will solve many of these problems instantly. On top of that, of course, there are other diseases that will occur, and the government does need to increase its investment in health. I think at the moment it still stands somewhere between 1 and 2% of the total government budget. That is not enough. It should be around 7% if they are to provide an adequate health service for the people of Nigeria.
The government is working hard with partners around the world who have offices and presence in Nigeria to ensure that the right treatment and the right prevention is out there at the community level to prevent these kids from dying from pneumonia.
Other stakeholders are of the opinion that intensive breastfeeding at early age prevents children from contracting the deadly lung disease. Recently, the International Vaccine Access Center had released a statistic which showed that Nigeria ranks among countries that contribute 70% of global burden of pneumonia, and these experts believe it is caused by ignorance as many Nigerians are exposed to cold. With the latest assurance by UNICEF, Nigerians are hoping that the rate of contraction of pneumonia will drop drastically and those already affected will get proper medication. Rose Audu, reporting for Clearview Television.